Hi there. Today we're going to talk about disorders of the thyroid, parathyroid gland, and nursing care related to these problems. When I do these on video, I try to keep them to 10-minute segments. That gives you the opportunity to take a break every so often, and it makes uploading the videos better. The thyroid gland is located in the anterior neck in front of your trachea. You can see it here. It's got two lobes with a bridge between the two, kind of crosses over the windpipe. It's a very vascular organ. That has implications for any kind of surgery that's done. The thyroid hormone is produced by the thyroid gland in response to hormonal stimulation, and then the thyroid hormone enters the bloodstream from there. The thyroid gland actually gets its signal from the pituitary gland, which gets its signal from the hypothalamus. So the hypothalamus in the brain is where it starts. The hypothalamus releases the thyroid releasing hormone, which stimulates the pituitary gland to release the thyroid stimulating hormone, which stimulates the thyroid gland to produce its hormone, T3 and T4. Those hormones are released into the bloodstream, where some of them are bound by thyroid binding proteins that are produced in the liver. So there's always this flux between bound hormone and free hormone. It's the level of free hormone that inhibits the pituitary gland. So as free hormone goes up, the pituitary gland is inhibited from stimulating more thyroid production. The major functions is the production, storage, and release of thyroid hormones, thyroxine, which is T4, and triiodothyronine, which is T3. The thyroid gland also produces calcitonin. Oh, that's on down a little bit farther. If we think about T4 and T3, the main functions of those hormones are metabolic rate, which then impacts calorie requirements, oxygen consumption, and carb and lipid metabolism. And then also it's extremely important in growth and development, brain function and nervous system activity. So much so that if a child is born without a thyroid gland, they will be mentally retarded unless thyroid hormone is instituted at birth. The thyroid gland also produces calcitonin. Calcitonin is secreted in response to a high calcium level. Calcitonin inhibits calcium resorption from bone, increases calcium storage in the bone, and increases renal excretion of calcium and phosphorus. Calcitonin is inhibited by somatostatin. And somatostatin is also called your growth hormone inhibiting hormone, or it's also called somatotropin releasing inhibiting factor. So there's a lot of these hormones that have more than one name. Somatostatin, also called GHIH, growth hormone inhibiting hormone, is produced in the hypothalamus, and it inhibits the release of somatotropin. So somatostatin inhibits growth hormone and the thyroid stimulating hormone. Basically, calcitonin opposes the parathyroid hormone. A goiter is an enlargement of the thyroid gland. It may result from hypertrophy caused by excessive stimulation of the thyroid gland by the TSH hormone, TSH coming from the pituitary. TSH stimulation is caused when there's not enough circulating thyroid hormones or when there's some other goitrogens. A goiter can be associated with either hyper, hypo, or normal thyroid function. So without measuring the thyroid hormones, you really don't know, just because someone has a goiter, what their hormone situation is. So this lady, you can see the goiter. Here's another picture of a goiter. See the thickness here. So hyperthyroidism is caused by an increase in thyroid hormones. One type of hyperthyroidism is Graves' disease. Graves' disease is actually a multi-system autoimmune disease. In children, it makes up 5 to 10% of thyroid disorders, much more affecting females than males. And in adults, it's going to be 4 to 10 times greater in women, especially in that 30 to 50 year age group. The etiology is unknown, but susceptible persons become sensitized to and they develop antibodies against antigens in the thyroid gland. These antibodies, called thyroid stimulating antibodies, TSA little bs, thyroid stimulating antibodies, they attack the thyroid tissue and stimulate it by acting like TSH. So these antibodies act like TSH, stimulating the thyroid gland while at the same time destroying it. In Graves' disease, you typically see remissions and exacerbations. It can progress to destroying the thyroid tissue. Graves' disease is usually going to be associated with exophthalmos. 20 to 40% of patients who have Graves' disease will have exophthalmos. Some other causes of hyperthyroidism include thyroiditis. Thyroiditis is any process that causes swelling or inflammation of the thyroid gland. Hashimoto's is a type of thyroiditis. It's also called chronic lymphocytic or chronic autoimmune thyroiditis. This can run in families. Hashimoto's thyroiditis is actually the most common cause of thyroiditis. Symptoms are usually mild, and they may actually present as hypothyroidism. Sometimes the inflamed cells can initially irritate the thyroid, producing a hyperthyroidism. Eventually the thyroid cells are destroyed and you have scarring and hypothyroid. There's a painless thyroiditis called subacute lymphocytic thyroiditis, and some people think this is just an early Hashimoto's. It usually resolves in 3 to 12 months. Sometimes it's called silent thyroiditis. This can actually happen in women after they give birth. Within the first 1 to 4 months after delivery, the hyperthyroid or an overactive phase is most common. And then there's a second phase where there's a hypothyroid period, usually 3 to 8 months postpartum. The treatment in this phase is thyroid hormone medication for about 6 months. Then the medicine will be stopped to see if or not the thyroid has recovered its normal function. Sometimes the medicine stopped permanently, or sometimes it's resumed because there's permanent injury to the thyroid gland. There's also a subacute granulomatous thyroiditis, and that's a painful thyroiditis. It happens equally in men and women. It tends to start out as a harmless virus, flu or cold. It invades the thyroid gland. It hurts. The front of the throat is sore, and there may be pain that extends up into the jaw or the ear. Sometimes only one lobe of the thyroid gland can be affected. Now, acute thyroiditis is pretty rare. It's also painful, and that tends to be caused by a bacterial or fungal infection in the thyroid, causing pus to collect and form. So here you have a normal thyroid, and here you have an inflamed thyroid gland. A nodular goiter is a small autonomously functioning nodule or nodules what it means by autonomously functioning is that they're not TSH dependent, so they don't turn off. You know, normally if your thyroid hormone goes up, then the TSH is inhibited, and so you don't have continued stimulation. But in these nodular goiters, the goiters function without that TSH impact. There may be more than one. If it's associated with hyperthyroidism, then it's called toxic nodular goiter. It tends to be slower to develop and less severe than Graves. So these goiters secrete thyroid hormone. It occurs equally in men and women, usually over the age of 40. And it's usually not associated with the exophthalmos. Here you can see a normal thyroid and a nodular thyroid. All right, this is a good place for a break.